My name is Andrew Pinto, and I'm a physician and scientist at the University of Toronto. And I want to begin by acknowledging that we're located in Toronto, which for thousands of years has been the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit. And Toronto is covered by Treaty 13. Today, Toronto is, of course, still the meeting place and home to many Indigenous people from across Turtle Island. And we are all very grateful for the opportunity to be on this land, to live on this land, and work on this land. And we acknowledge our responsibilities to uphold the calls to action of the Truth and Reconciliation Commission and the National Inquiry into Missing and Murdered Indigenous Women and Girls, particularly in the context of our work as researchers, as clinicians, and as service providers. I direct a research team called the Upstream Lab. We're a diverse group of academics, clinicians, data scientists, qualitative researchers, patient partners, community members, and students. And our four areas of work are tackling the social determinants of health, supporting population health management, using data science to enable learning systems, and supporting clinical trials. You can find out more about the Upstream Lab at upstreamlab.org. And you can follow our work through our social media channels and our monthly newsletter. Today's topic is on building bridges and specifically around the issue of homelessness. And building bridges is, I think, particularly important at this time. We know that the social challenges that we're all witnessing, whether they are the rising cost of living and poverty that is a result of that, to the climate crisis, to the issue of violence at the individual level and also at the societal level, they all need multiple perspectives and people pulling together in the same direction for change to happen. And today we're going to talk about the intersection between community work, clinical services, and research that engage people experiencing homelessness. Now, many people attending or listening will know that in Canada, homelessness is a rising issue. On any given night, there are at least 35,000 people who are experiencing homelessness, and many more, at least 50,000 additional people who are what are called the hidden homeless, who are, couch surfing or without shelter but sheltering with others. And for every person who is experiencing homelessness, who is sleeping rough or in a shelter, there are many more who are at risk and are very close to homelessness because of things like being unable to pay for rent and are at risk of being evicted. Now, homelessness itself is a symptom of a much bigger problem. It relates to the issue of a lack of affordable housing, which in turn is related to how housing over just the last few decades has become financialized. And it's moved from being a right that we have to an asset that people make money off of. There's also a lack of financial support for people who are unemployed or who cannot work because of disabilities. We've also all seen, particularly accelerated by the pandemic, a rise in cost of living and inflation that are pushing more and more people to spend a huge amount of their funds on housing itself. And homelessness is also related to the social and health systems that are supported by our tax dollars, but which have been chronically underfunded. People experiencing homelessness often interact with the healthcare system, for example, the emergency rooms and departments, primary care, or engage with mental health and addiction support. And yet those systems often lack the tools to tackle the root causes and, for example, are often helpless in terms of helping people with housing issues. In my own practice, I've seen how people's health deteriorates when they're experiencing homelessness, but also on a positive note, I've seen when people gain housing and are in supportive housing, how much their health can flourish. So I'm joined today by two amazing people who I've had the privilege to work with. Alexander Zsager is a researcher, consultant, and advisor for over 20 years. He's advised organizations from the Mental Health Commission of Canada, St. Michael's Hospital, Dixon Hall, Toronto Metropolitan University, and many others. And he's been an amazing partner and colleague and teacher to me and others at the Upstream Lab. And we're also joined by Mathieu Isabelle, who is a PhD student at the Dahlana School of Public Health, and I have the great privilege of being his supervisor and colleague. He's a practicing family physician and assistant clinical professor at the Université de Montréal, Department of Family and Emergency Medicine. And he's part of a community clinic that specifically focuses on delivering care to people experiencing homelessness. So thank you both for joining us, and I'll turn it over to you, Mathieu.
Thanks a lot, Andrew, for organizing this talk, as well as all the team that is involved. Hi, Alex.
Hi, Matt.
So we decided to have a conversation today, right? And so for those of you who are watching us or listening, I know it will be hard, but there will be no PowerPoint. We are just trying to have a conversation to share our experience, our views on yes, homelessness, but how research can be integrated within community work, within healthcare services, to improve the lives of people experiencing homelessness. And before we start, we're going to be sharing our experiences, our visions, but maybe it would be interesting for us, Alex, to kind of just share briefly with people, what type of hats are we wearing today? What do we bring in terms of experience, the type of visions, training, background, experience we have, briefly, so that people can follow us maybe better. So Alex, what hats do you wear today for this talk?
Well, I totally agree with you. And as a person with lived experience of homelessness, I've went through a lot of difficulties in accessing any type of care. Now, things are getting much, much better from before when I became homeless. But it took me 2 years just going door to door and trying to access any services or any type of help that was available out there for me regarding food, housing, any other health services, just about anything, even getting to appointments for employment reasons. Everything in the system seemed to be failing. There was absolutely nothing out there for me to navigate or to be able to get help in any way. It was either up to me or stay where I was. So I took it upon myself to do that and search out everything I could. And since then, I've become a staunch advocate for the homeless. And I decided right then that I'm going to try and help as much as I'm capable of, whether it's in research or consulting or presenting or any other form that would help navigate the system and help bring these services to the homeless so they don't have to go through the nonsense that I went through trying to get the help I needed. So that's kind of the hat that I wear. But I also like, who can become homeless? Anybody and everybody can become homeless at one point in their lives, and it doesn't take much. It could be a serious accident, that has left you without being able to get a job. It could be a serious illness like cancer or stroke or any type of heart disease. Again, leaving you unable. Could be the economy, the environment. Look at what we went through in COVID with the pandemic. How many businesses were lost to people who relied on those businesses? So it doesn't take much to become homeless. And it could happen to you or anybody else at any point in their time. And nobody wants to be homeless. And we certainly don't ask to be homeless. It's not like, well, hey, I think I'll be homeless, for a while and see what that's like. And we forget, like we look at it as some sort of like, why do we not talk to a homeless person and listen to their story, find out what has happened to them that put them into this situation? Or just you'd be surprised at
Yeah.
and it was just something unfortunate that happened in their life that was out of their control. And like I say, nobody wants to be homeless. Nobody asks to be homeless. And I'm sure we'll get along to it's not something that you can catch.
Yeah, it's so important what you just said, this notion that something can happen to you and you individually, and also we're part of a social system that also put people at risk of homelessness, and then something can happen to you and then you start experiencing homelessness. And it's an important reminder that you're telling us. So these hats of yours that you've shared with us are extremely important in today's conversation, and I know these hats, you've been wearing them for many years. Mine now, just briefly, like I have more of a professional experience, if I may say, with homelessness, in the sense that, as Andrew mentioned, I'm a practicing family physician in Montreal. I work in a community-based clinic, a CLSC, downtown Montreal. I've been working there for 5 years now. Not this year, though, since I'm doing the PhD. And we've been working in this clinic as a group to help people experiencing homelessness. And the group is yes, physicians, nurses, social workers, peer support workers, psychosocial educators, community members, that's one of the hats. Also, before joining medical school, I had studied in social work and worked as a community worker in different community organizations in Montreal. During my previous life before medicine, if there's such a thing. And I've been able to work and interact with people experiencing homelessness. And so I bring this vision that is different than yours. And also the things that unite us as well is the research part. And that's something we'll talk about. Like, what can research bring in the field of homelessness and to people experiencing homelessness? So regarding homelessness, Alex, when we met before to prepare this discussion, we didn't want to prepare it too much. We wanted to be spontaneous. But one of the things that struck me when you were talking about homelessness is the multiplicity of realities that exist in homelessness. And that's one thing I've been seeing. And we tend to see homelessness as this static, almost stereotypical image of the person on the street or the person on the bench in a park that looks isolated, and but there are as many situations of homelessness, as many stories of homelessness as there are people experiencing homelessness. What is your view on this? Like this multiplicity, is that something that you've also been seeing?
Yes.
Yeah.
Yes, it is. And the problem is that we're not talking to the people on the street. We're not talking to the homeless person. We're walking by them and ignoring them as if they were some kind of disease or virus that we don't want to catch. Like, oh no, I don't want to, go near this person. But if you actually talk, we have to build, and this has been going on for a long time, and we're starting to get better at it. It's to listen and build a relationship between that person. Let's hear their stories. What got them into that situation? You'd be amazed I mean, I know people who have their masters from Harvard, and that have had their own business, and many of them have had their own businesses, their own trades. They're plumbers, they're drywallers, they're well-educated people, but like I said, something traumatic has happened in their life, and they become homeless, and we're ignoring that instead of sitting down and talking to them and saying, how can I help you? Now, like I said, in my search, I had to do everything for myself. There wasn't anybody there to help me to navigate through that system. We're working better now at getting that navigation, and more of the homeless are starting to realize that they have some value and they want to be in the discussion around their health care, around their situation. They want to get involved. And building that, you got to realize that a lot of trust was lost between physicians and healthcare for the homeless, because nothing was ever really done for them, or they were shunned aside. And we still get that in some of the hospital settings. Unfortunately, there's still a lot of stigma and uh, just a lot of what there's no trauma informed training, or a lack of trauma informed training in a lot, or they're not enforced, and that could be a problem. And the other thing is that our and which you will, I'm sure, talk about later, which Andrew and I have talked about on many occasions, is that a lot of the physicians and the students coming up now, the residents, have no training whatsoever, have never even met a homeless person, let alone talked to a homeless person. And yet they're put into a situation where they say, well, I know what's good for you, but I've never met a homeless. How do I know what's good for you? So we gotta start talking to our homeless people. Find out. They'll tell you what they need.
Yeah.
They're not gonna hold back for you. They're gonna tell you exactly what they need and how you're gonna be able to help. And the more you build that relationship, the more trust and value you're gonna get out of it.
Absolutely. And that two important points I hear from you here, like this notion of focusing on stories, and we'll get back to that later, and how maybe it's a way that research, clinical work, and community work can be brought together. This notion of focusing on story and what is behind the story, that's one important thing. And one analogy I use with the students who come to do clinical work in the clinic downtown Montreal, when we work with people experiencing homelessness, and you're right, people have never either met, or the type of experience they've had with homelessness is this very stereotypical, at distance, I don't want to get close, I'm uncomfortable, I don't know how to approach this, and it's fun. And one thing I always tell residents and students is to really, using a medical analogy, but is to really see homelessness as a symptom and not a diagnosis. And what I mean by it's like, for those of you in the room that are clinician, like it's like fever, like you want to understand, fever is a symptom of something, let's say, of something happening in the body. You have to understand what's going on, so homelessness is a symptom of something. It can be individual factors, but mainly social, collective factors that are happening. And in your role is to understand what is it that led people into homelessness. What is it that in their individual stories led people into homelessness? And to know the story, well, you have to ask about the story, as you said. And yeah.
And it's very difficult. And I'll give you an example. I remember when I first became homeless, I refused anybody's help. I didn't want to. I got myself into. I'm going to get myself out of this situation, and I focused all that on me. I was not going to. I didn't want to beg. I didn't want to go out and say, and it's funny how quickly all your friends kind of now don't know you anymore or don't want to associate with you anymore.
Yeah.
But again, it's like, we're not, we rely too much, and that has happened in the past, that we rely too much of trying to do everything ourselves. And until you get to that point where you can actually say, you know what, I really need help and I can't do this by myself, and that's where the relationship starts to build, and that's where the relationship is defined. Are you actually going to help me, or are we just talking? What can you actually do for me that's going to meet my needs?
Yeah. And that part, I will bring it back later a bit, because this is so important, what you said, this the real intentions people have behind their offer of services and help, and we'll get back to that, but this is so important. So, and one last thing that resonates with me, what you said, and I've been seeing, is that behind homelessness, there is, it sounds almost cheesy, there is a person, but it is fundamental. Like we say, people are experiencing homelessness. They're not homeless people. And it may be maybe just a linguistic thing for certain people, but correct me if I'm wrong, but I think it has a lot of meaning, in the sense that you are more than homelessness. You are more than this situation you are now currently living in, or you are experiencing, whatever reasons or factors, but trying to, well, not trying, you must see the person as a full individual, and that has
That's
aspiration, that may have yes, a difficult past, but can have the right to dream of a better future in a better present. And that's this humanity you need to look. And it may sound almost esoteric what I'm saying, but I think, and tell me what you think, this is the most important key, to see the human behind the homeless. If I'm doing a quote for those who will listen to the podcast instead of seeing us.
it it most certainly is, and I wish there was somebody that was behind me helping me. And I, like I say, now it's getting better, but there are so many stories that I could tell you about. There's one individual, when I was doing some research for Dixon Hall, and he was on his last rope. Nobody was there to help him. He had no help whatsoever. But just before, a gentleman walked up to him and asked him how he was and whether he was hungry or what he need, and proceeded and took him to the nearest McDonald's and fed him. That gentleman saved that person's life. And to this day, the person who was homeless at the time is now have a job. He's doing well in society, and he keeps saying that gentleman just saved his life.
Hmm.
Now that's being human, and that's being so, and all it took was just a simple hello, how are you, how's your day?
Yeah.
And there are many stories like that.
Yeah. Stories, relationship. And that's one thing I definitely hear from this powerful story. Now let's switch, if you're okay, to research, because I see time flying by. We knew this would happen, that we would talk a lot, which I really enjoy. And I think it's important for both of us to open up for question at the end with people who are here with us today. So research with people experiencing homelessness, research with organizations who work with people experiencing homelessness. Why do you think that research is important in homelessness, if I were to ask you?
Well, you need to find out what's not working. And if we want to find out what's not working, that relies on data and research. How do we collect the data is very important. Do
Mhm.
we include the people we're researching? Like, it's okay to do the research, and unfortunately there are still some people out there who will say, well, we're using people with lived experience in our research, uh, but they're actually not listening or not putting any of their input into. They're doing it because they just got the grant because they included people with lived experience. So the research, everybody who is involved, any person, and you have to involve people with lived experience. If you wanna know what's going, you got to talk to the people it's affecting. How are
Mhm.
you going to do your research if you're not talking to the people that it's directly affecting? And they'll be happy to talk to you, and they'll be happy to tell you what's not working and what isn't, or what is working. But again, you have to build that relationship and that trust, and develop on that, and include the people with lived experience or peers in all aspects of that research project, and make sure that you're actually listening and inputting
Yeah.
what they're saying.
Yeah.
And that way you're going to get some really good data.
Yeah, and that's very interesting, the data part, and as well, and maybe just to share a personal experience of a research project in Montreal we conducted in the community clinic, the CLSC in Montreal, where we just did a pilot project to implement within the primary care team a peer support worker, and we did that during the COVID pandemic. It was intense, but so necessary, so useful. And one of the most important learning of this research project was that research helped the clinical team and the community organization to communicate better. Research served as a bridge during this time, because for clinicians to see a research team coming into the clinic, it's either two things. It's either like, oh, who are these people who know it all that are coming and tell us what to do? Or to the contrary, maybe it's like, as you said, we're here to figure out what works, what doesn't work, what's needed. We're here to work as a facilitator to bring people around the same table. And that's one of the power of research, I find, is that it's a socially and institutionally acceptable and recognized way to take a break and reflect on what we're doing. And in the busy lives of clinics, in the busy life of community organization, working with people experiencing homelessness, sometimes we just don't have the time. There's so much to do, emergencies after one the other, and research can create the space. And I found that was quite amazing to step back and reflect and be like, oh, hold on, like we've been working in this clinic for X amount of years, and we realized that we've been really medicalizing homelessness in a way that we never questioned. We never really looked at the impact of defining homelessness under a medical lens, because we just take it for granted. And research can help us when it's well done, facilitated as well, to take this step back. Same for community organization. And so I think this is one important role that research can play.
And it brings out more qualitative research rather
Yeah.
than quantitative, which has been the norm for a long time. And I know I used to walk into some research projects and they, oh, well, yeah. And I'd look at them and I'd say, how many years experience do you have with the homeless? Well, you know what? I have over 20 years experience with the homeless. So who do you think knows more about the situation, you or me? And I think you better listen to me.
Yeah, and welcoming that knowledge, and I want us to go back to notion of building relationship, of building trust and building bridges. And we've started our conversation saying how much time it takes. And you mentioned initially how when you first started experiencing homelessness, you wanted to do it all by yourself. And that's what you said. What's behind this? I mean, I have my thoughts, but I'd like to hear you like about why is it important to respect people's rhythm? Why is it important to respect and go at the temporality and the speed that people want to go to in this process of getting help? Why is it so important?
Well, like I said, I started out, I figured I could do it by myself. After a while, I realized that, I'm gonna need help because I don't know the entire system. I don't know how to navigate the system. I'm gonna need help finding out what services are available. How do I access the services? Where can I find food, housing, whatever? So it was a whole new setting for me, and it's probably a whole new setting for anybody who's getting into that situation. All of a sudden, you've never been there. Everything's been there in front of you, and now you've got to kind of search for that. But it takes time, and in order for the relationship to work, you have to kind of start, and it will take time. You start slow, a simple hello, every day, hello, how are you? And build on that. And then when the person is ready, they will openly ask for your help. But they've got to have that, well, you know what, I can trust this person. I know he's there, he's gonna help me, and the only way you're gonna build on that is simply by talking to the person and building on that relationship. That is so important because that has been lost so much over the years, and now everybody's finding it hard because the trust was lost. Nothing that was committed or told that they would receive came true. So how can I trust you when you tell me you're going to do this, and then 5 years from now I'm still not getting anything?
Yeah, and it takes time, as you said, right? To build trust, it takes time, and that's one thought I've developed over time after the 5 years of clinical experience and the previous community organization is, tell me what you think, but it seems very difficult for clinicians to accept that maybe people do not want help. Maybe they are not ready. It seems difficult to accept that people are not taking the hand you're lending them. And I think that's one element as well that needs to be reflected upon is why is it that we're so uncomfortable with that notion of refusal and respecting that people, as you said, maybe they're not in a process, maybe they're not at a place where they're willing to ask for help or they're ready to ask for help. And that's my understanding. It's as if we infantilize. Is that a word in English? Or we don't respect people's autonomy, and maybe they're not ready right now for whatever reason. And my question is, would we question that refusal in another patient that is not experiencing homelessness? Would we respect this choice? And so that's a thought I've been having for a long time, that it's important not to force anything. The importance to be present, to offer your presence, to suggest things, keep being there for people. And in Montreal, in my schedule, I have these, they're called the 5 minutes, the 5 minutes hello, that people in my team can just book whenever during the day. And sometimes they knock at my door when I'm with a patient and they're like, it's just a 5-minute or 2-minute hello, because they've been working with somebody and they're building a relationship slowly. And now my colleague, whether it's the nurse, the peer support worker, the educator, feels that A, it would be useful to meet a physician, and B, they feel it's now the right time to just say hello. And so I just go and I say hello and I chat. And a lot of the time for the residents who are with me, they're like, oh, you haven't done anything medical. I'm like, no, I've done a lot with this simple hello that will set the stage for something else later that may or may not come. But this is so important not to skip these relationship building moments that are to be so pivotal in the future.
Yeah, you're right. And that's all it takes is a simple hello and a little smile. And hey, listen, I'm here to help. Whenever you're ready to come forward, just let me know.
Yeah. And building relationship is I think an important element with people experiencing homelessness, but it's been also, tell me what you think, but so important to build relationship with partners, whether they are in community organization, whether they are in other healthcare systems, whether they are with research partners. But it's a no-brainer that good relationships between people probably will result in, well, has a higher chance to result in better work, in work that is more important. But it's key to develop these relationships with people who are maybe the other side of the street. And there's a gap sometimes. We don't realize it when we're the healthcare system. The way community organization works, we take for granted, or we suppose that things work in a certain way, but that's not at all the way it is. Community organization for having worked in there, like we can have a vision of how the healthcare system is designed and functions, and there's a lot of misunderstanding sometimes, and we don't realize the extent of what can be achieved if actually people are offered full potential to deploy all their tools. And so getting to know each other between researchers is important, right?
Relationships with partners and other organizations are very important, because I can say, yes, I'm here to help, but I can't help you with everything. I don't have the resources to be able to do that. So who do I look for? Is people or organizations within my community, in the surrounding community, that perhaps have a hand in housing or have a hand in healthcare, addictions, mental health resources, whatever resources my clientele or the people I talk to tell me that they're looking for. These are the resources and the services that I'm looking for. And I start within my community. If I can't get those services in my community, I'll expand. But you start within your community, because people are more, I guess, more open to getting services in an area where they belong or where they know, and this is their community. And you're also building that relationship within that community. So that's very important. But yeah, it definitely important. Like I said, you can't do it all by yourself. You gotta have help.
Yeah, you can't do it all by yourself. So important. And before we finish, you said one thing, and I want maybe to conclude with this. You mentioned, and I know it's from your own experience, but also the 20 plus years of work, advocacy work, research work, and there's something about sincerity in the work, and how you said how you can, I don't want to say spot, but feel when people's intentions are in the right place, should I say. What did you mean? What did you mean with this?
Well, yeah, I mean, I had people even when saying, "Oh yeah, we'll help you with that and that," and I could pick it up just by their facial or body movements or the tone of their voice or whatever. So I know when a person's being sincere. If you really want to help me, then tell me you really want to help me and be sincere about it. I can tell whether you're sincere or not, just by the way you're even talking to me, or yeah, I'm going to help you, and you keep looking this way and that way and whatever, and fiddling with whatever. You got to be paying attention. Listen to that person. And I mean, when you're communicating with that person, you're listening, you're watching them, and that shows the person that, hey, this guy cares. He's not doodling or whatever. He's actually listening to me and listening to what my needs are. And trust me, they'll pick up on that very quickly.
Yeah. And I know that we're done. I see Andrew now, but the last thing I'd like to say about this sincerity and this humility is it goes, yes, when you interact with people experiencing homelessness in a clinical setting, community organization, but this is a very important point also in the research setting. Why is it that you're conducting research in the field of homelessness? Is it to really tackle important issues that are systemic, that are political, that are at the level of one-to-one intervention? But this question of why is it that we're doing things is so important. And I think that's also one thing that research can help us with, is to sit down and take the time to reflect on these things beyond a simple grant application that we need to have, So yeah, 12:45 seems like a good moment to stop here. Alex, would you have anything else to say before we open up for questions and comments from the audience?
No, nothing further. I'm open to any questions.
Yeah. We'll have to continue, you and I, over coffee.
I want to really thank you both, Mathieu and Alex, for your thoughts today, and we're going to turn to questions. So please, for those who are joining us, feel free to put questions in the Q&A, and we'll just go through them. I just wanted to highlight a number of the things that came up. One was the importance of understanding each person as a unique individual who has a story and set of experiences, and that, as Alex, you put it, that really anyone can experience homelessness. It's something which we don't often accept, and we tend to default to this idea that it's only something that affects some people, and with a lot of shame and stigma with it. But really, it's something, given how precarious so many systems are, that really it can affect anyone. And so that idea of understanding the individual and understanding kind of the narrative behind them. I think another really key point that came up was sincerity and humility, and really approaching each person with this understanding that we're all human, that we all have the same needs for basic things like shelter and food and support, and just warmth in our connections. And then the third was around the role of research. And I think, as Alex, you put it, we need to understand, because something has gone wrong, we need to understand solutions. And I'll maybe just add that one of our goals, I think, with the Upstream Lab is to go upstream of the immediate issue. So if the ultimate issue is that people are being evicted, people cannot afford rent or housing, that there's a lack of it, that it deals with how housing has become a financial asset, and we've moved away from the right to housing. It's trying to go as far upstream as we can to do that. So I see some questions in the chat. We're going to first take one from Ashley, which really I think is a very common thing that we all experience, and I'll just pose this to you both, which is, as an individual, when we see people experiencing homelessness, and in a city like Toronto, we see hundreds of people visibly experiencing homelessness. What should we do to try to connect with that individual and how to balance that with a worry about safety as well? We're currently going through a time when there has been an increase in violence on things like the Toronto transit system. And so it's understandable that people are worried. So how do we respond? And I think it's always important to make the point that, of course, people who are experiencing mental illness and homelessness are themselves at greater risk of violence than and being a victim of violence than perpetrating it. But it's very understandable that we have these concerns. So, Alex, do you want to start with that?
Yeah, I understand the aspect of the violence because of the mental health, but a lot of the times too, when they're seeming a little bit aggressive, it's sort of a defense mechanism. You got to remember, they live on the streets. They don't know who's gonna come and try and steal their stuff or do whatever. And it's kind of, they act tough, but in a sense they're not. But that's their defense mechanism. And I wouldn't say go up to them and whatever. But when you're walking past, let's say, a person just sitting on the sidewalk or whatever, just a kind hello, how are you? As you're walking by, rather than doing an exit around them or whatever. Just a simple hello, and you know what? That could make that person's day. Just by that simple hello, somebody actually stopped and said hello.
Yeah, Matthew, anything to add?
Well, maybe I'll just take a different angle in like questioning why is it that we feel so uncomfortable, and what's behind this discomfort we feel, and in a way, I experience it myself on a daily basis. It's this discomfort for me is this sort of like, what is it in this system that we live in that has failed so that some of us are in this situation? What is it about social housing? What is it about access to healthcare? What is it about economic policies? What is it that actually makes the safety net too loose? Is that the word in English? But and so this discomfort, in a way, we're is not only seeing an individual that may threaten my sense of safety or my level of well-being. It's deeper than that, and that's exactly what we need to tackle, as you said, Andrew. Like, this discomfort points at systemic causes that are upstream, and that is an important point we need to consider.
I'll just make a thought, and then we'll go to another question that was posed. But this conversation also reminds me of Frantz Fanon, who is a psychiatrist and also an anti-colonial freedom fighter and a important social scientist who kind of talked a lot about and brought in the idea of alienation into this, and how systems, whether they're colonial systems or systems of systemic racism, they lead us to become alienated from one another. And I really liked, I think, Matthew, your point about just creating space to have human connection that can start to overcome things, and it influences the way we think about our role, our work, and I would say it changes the ambitions too of what we can do. We open up new ways of thinking about very challenging issues like homelessness, and it's often through that experience. I'm going to go to the next question then, which may be our final one, which is from Joe, who asks, what's the role that researchers can play in supporting advocacy groups that are addressing things like homelessness and poverty? So what's the intersection of research within this? Maybe we'll start with you, Matthew, and then you, Alex.
Yeah, that's a very good question, Joe, and I think it's a fundamental one. I think research has the capacity, the capability to work in collaboration with advocacy groups. But research, on the other hand, if not done properly, can actually just reproduce certain issues of discrimination, of stigmatization, and so it has the power to bring people together around a common agenda. Research has the capability to shed a light on important systemic issues, and in that way, I think research can be a great asset for community-based group, and should be, but it's not because you engage research with advocacy group that it will be done properly. And so that's an important lesson to remember. And the second part I would say is that if research is done in a real participatory way, it means you have to clearly listen to what's happening on the field. What's happening in these groups? What are these groups, advocacy group, community group, telling you? What is their concern? What is the most important things that they're telling you we should be focusing on in the research? And so in that sense, research has lots to offer if done properly. Yeah, I'll say that.
Alex, and maybe we'll give you the last word actually for this. What's your perspective? Because you've been involved with discussions with policymakers, both in health and in kind of the social system. What have you seen the role of researchers and research teams in those discussions?
Well, they're getting to the root of the problem. A research project has to rely on data through information giving by groups of people. And we're getting the groups of people together that are the result of the success or the unsuccessful data that's being offered. So now we're including people that we're researching about. And the thing is, by including them, we're giving those people a voice, which will be heard and hopefully implemented. So research gives a voice to the people who will otherwise not be able to have that voice go forward to people who are actually going to be able to implement real-time improvements. Such as government or whatnot. Without that research, we wouldn't have a chance. But by including people, and now we're starting pilot projects with peer involvement, and there's so much good coming out of the research, and it includes introducing and getting together everybody involved. So you have to involve the people you're doing the research around. And I think that's one of the best things that has come out of research. And again, like I said, you're giving a voice to the people where it can really do some good and empower governments to make change.
And I'll just add to that. I think by having somebody who has experienced homelessness, in the room, it can really change the discussion and the tone of the conversation, because it's a reality that the policymaker can't avoid. Whereas they find it, possible to avoid and simply say, well, we don't have funding. This is impossible for this year, maybe next year. By having somebody who is experiencing homelessness or has experienced it in the room at that moment, it's unavoidable to say, well, that's not acceptable, and we need to do more. People are dying. This is an emergency, and we need to tackle it as such. And it's always, I think, as researchers, always really aiming to pair the data and the findings from our research with actual stories, and to also never have stories without the data as well. So the power of that, can be there. We ultimately want to make it easy for the policymaker to say yes, to agree with whatever the plan is. So by actually providing also those stories and that experience, it allows them to, because then they're able to stand up in Parliament or stand up wherever and say, I met with, Alex and Dr. Isabel yesterday, and they were telling me about this, and that's why this is important. So although sometimes we find it really hard to engage with policymakers on these issues, and they feel very difficult, ultimately we have certain ways that we can make their jobs easier, by bringing solutions, by bringing the evidence, but by bringing the people and the face behind that into it, and being directed by that. Having the meeting really be centered around the person with lived experience. So I know we're right at time, and I'm going to just draw us to a close. I want to thank you again so much, Alex and Mathieu, for your comments and your discussion today. I want to thank everyone for joining us. And please do stay tuned for future speaker series like this. And again, you can check out upstreamlab.org and our newsletter to keep updated. Thanks so much, everybody.